Hi, and welcome to the Colorado Health Foundation's Consumer Advocacy Funding Opportunity Evaluation webinar. My name is Kelsey Price, and I'm the Director of Research and Evaluation here at the Colorado Health Foundation. We're so happy to have you join us today to learn about the evaluation work that is part of our Consumer Advocacy Funding Opportunity. This funding opportunity is part of the Foundation's work in supporting Coloradans to choose, use, and maintain adequate health coverage, and to address healthcare costs and affordability to ensure that coverage expansions are sustained across time. Our consumer advocacy work is an adaptive strategy which supports and advances the work of the field of consumer advocates in Colorado towards health policy targets which were identified with the help of advocates. The specific goals of this funding opportunity include to help ensure public policy adequately addresses consumers' needs regarding health insurance, access, and affordability, and to help ensure that Colorado has an effective field of consumer advocates and consumers proactively influencing public policy decisions regarding health coverage and costs of care. To help us assess the progress of this complex work, the Foundation has joined with Spark Policy Institute as our evaluation partner. Spark has designed and are conducting the evaluation of the Consumer Advocacy Funding Opportunity. So with that, I'll turn it over to Julia Lin, the CEO of Spark Policy Institute, to talk to you about the evaluation.
Thank you, Kelsey. So I imagine an evaluation webinar is probably not the most exciting thing that you're going to do today. So I assure you that we're going to be fairly direct to the point and hopefully providing you with some insight about both what the evaluation looks like and the opportunities for learning that come out of this evaluation. So I'm going to walk through very briefly what our agenda is here today. We're going to start just giving an overview on both of the funding initiative and then the evaluation activities specifically. We're going to provide some clarity around what the grantee involvement will be in the evaluation and give a sense of the timeline for it. We'll also have some resources that Kelsey will refer you to at the end of this webinar, some online documents that will give you more sense of both the strategy and the evaluation. Let's dive in. So this is an adaptive strategy, and it's an adaptive strategy because much about the policy environment in Colorado is in a moment of shift. The healthcare reform environment is both predictable in the sense that we know some things that are required, but unpredictable because there are so many additional reforms underway, and how each reform plays out is unique to the context happening at the time. And for that reason, an evaluation that is rigid, that is focused on predetermined outcomes and kind of plans in advance what matters, may not pick up what matters the most as the work is underway. For that reason, we have an adaptive evaluation, and I'll get into more detail of what that looks like as we move forward. We also have an evaluation that's explicitly designed to inform adaptation. So not only are we adaptive in the sense that we will pay attention to where change is happening as it happens, we also want to be able to help inform that change in order for the Foundation and advocates to be more successful with the policy goals of this initiative. So the evaluation is integrated with twice-yearly advocacy strategy and learning convenings designed to create a space for dialogue about what's both being learned through the evaluation and also what's being learned by advocates, what you're experiencing on the ground. The evaluation design comes from a couple sources. First with some scenario mapping, some work that happened in the spring of 2014 with advocates. Also around that time we were developing a theory of change with the Foundation that includes the 5 policy targets. And then overall we're using an approach called advocacy evaluation that's a little different than traditional evaluation. It's very attentive to the unique context of advocacy and the way that change happens differently in advocacy settings than traditional program settings. I'm going to talk with you a little bit about the scenario mapping process. The evaluation is very grounded in what came out of the scenario mapping, and so it's important to understand that overarching information. So first is to know this is the scenarios, and they were developed through meetings with advocates. So we worked with about 40 different advocates representing many different perspectives to ask the question, what could the future look like? And what you're seeing in front of you is a grid of 9 different futures, 7 because 2 of them were identified as unlikely. 7 different futures. The reason you do scenario mapping is because we're in an environment where we don't know what the future will bring, and yet you want to be able to plan with some attention to that future by taking the time to assess what are the biggest drivers? What's going to define our future context the most? You're able to come to some conclusions about the potentials for the future and plan around a variety of futures. In working with advocates, the potential futures, the drivers, ended up being two very distinct concepts. The first is, what's the makeup of the political composition at the state level? Are we a red state, a purple state, or a blue state when we look at our legislature and our governor? And then the second one is, what's happening with health reform? And advocates were quite clear that health reform is health reform writ large. It is not just the Affordable Care Act, but the variety of different reforms that Colorado has been pushing forward for years and that the private sector is triggering as well, along with some of the great work happening at the local level. So when we think about these two different dimensions, it ends up, when you overlay them, creating a number of different potential future scenarios where we may vary in our political climate and vary in our success with health reform. And when you combine them, the types of advocacy issues we're experiencing and healthcare issues we're experiencing require different solutions, different ways to advocate, and different policy options. So let's get into some depth on a couple of these. So the first one, the overarching bucket, is epic failure. We're going to start with the depressing one and get to the happy news at the end. So in the epic failure setting, advocates identified that this is when health reform didn't even implement fully. That we have a lot of different things that we were trying to do, but for a variety of reasons we couldn't even implement them enough to know if they would have changed outcomes. This is things like the exchange is not sustainable. We haven't been able to resolve cost issues. We're dealing with increased enrollment into a system that hasn't reformed. We haven't had the delivery reforms. We're maybe in that stage where we have so many innovations happening that we're creating provider burnout. Maybe we're also in a situation where hospital consolidation had negative and unintended impacts. In this type of context, we have a private market that's unpredictable. It's unpredictable for consumers, for regulators, for providers, and consequently we have a driving need for change. Now when you overlay the political environment, first as advocates we're quite clear that it's unlikely to be a blue environment. Probably we won't have Democrats elected overwhelmingly in this environment. In a purple environment, they talked about how important it will be to find the compromise issues, the issues that really resonate with both parties and where the solutions are enough in common that we could move things forward. Cost containment came up a lot. And in a red environment, we would be looking at reforming and reversing as many things as we can given the federal context, and probably moving towards more market-based reforms, kind of trying a very different road ahead. So advocates talked about in this type of environment, there are different things that we need. We're likely to need a lot of data, economic data to find new solutions, data to help legislators understand what's happening in their communities and the impact of epic failure in those communities, but also new champions, new voices, that some of our traditional advocates maybe won't have the same credibility that they did before, and we'll have to bring in new voices from the community level and across the aisle. The next area of the scenario mapping is tried but missed the target. So this is the idea that implementation was tried. We implemented a lot of reforms across many different areas in our healthcare system. But despite significant work on implementation, we're not seeing movement on the triple aim, on population health, cost of care, and patient satisfaction. Advocates talked about how in this environment we might have a sustainable exchange, but people are still underinsured. They're just a little better than uninsured, but still their needs are not being met. We might begin to have really great delivery reforms which have potential, but they're siloed across different systems, and it's putting pressure on providers to respond to too many different reforms. We might see that some communities and some populations are benefiting tremendously from health reform, but others are being left out. We talked with advocates about how in this environment we would be likely to be trying to tweak reforms. There would be a lot of work, particularly in a blue environment, to take what was already planned and make it work better. In a purple environment, those incremental changes might be a little harder, but we would have support around things like cost containment and possibly payment and delivery reform. In a red environment, it may be kind of difficult to continue to tweak. It might be that we allow aspects of health reform to fail and then replace them with new solutions. In this environment, the policy priorities that came to the top that were very relevant had to do with the integration of care. That as we're addressing kind of the complexity of the different areas of implementation, connecting primary care, specialty care, oral health, and behavioral health would be critical. We also identified with advocates that this is a setting where we need to be paying a lot of attention to the innovations and having some convergence around them, figuring out which payment and delivery reforms make the most sense across the most systems. And doing things like beginning to capture the stories of success, having the public talk about what's working for them, really grounding the remaining changes in their experiences, both positive and negative. So the best case scenario is healthcare transformed. And in this setting, advocates talked about how not only have we implemented many different aspects of healthcare reform, but we've seen a shift on the outcomes. The triple aim is happening. We have cost reductions. We have improved patient satisfaction and ultimately improved patient health. In this setting, we're looking at an exchange that's sustainable. People are on good plans. They're no longer underinsured or uninsured. We've coalesced around key payment and delivery reform models. We're beginning to deliver very good quality care within those models, and we're reducing disparities in significant ways. And also, we might really see healthy, integrated, engaged local healthcare networks. Not that people couldn't still go out of their communities for specialty care, but we start to see that integrated care that we're looking for. We also might see a lot more use of data and metrics across systems and across sectors to have a common story about how we're causing change and how to continue to improve. In this environment, advocates talked about how it's important not to become innovation junkies, to fix the system until it's good enough, and then pay attention to other things like the social determinants of health, the drivers that affect healthcare outcomes that are outside the healthcare system. That we might want to bring in new leaders and new partners who have that larger perspective, and that we will have credibility, the advocates who are doing this work today, because they were part of the success, and so we can continue to reform the system in new and exciting ways. Across all of these environments, we have different policy priorities that surface. There were 5 priorities, the ones in the blue dots here, that were relevant in all 3 of the kind of versions of healthcare reform success. Cost containment is the idea that we need policies, like strategies that cut across party lines, that focus on the cost not only of delivering healthcare, but also the consumer experience of cost, both sides. Healthcare literacy was identified as about the ability of the public to understand how to navigate the healthcare system and take advantage of their new coverage, use preventive care, and really help drive down as a result the costs in the system. These 2 policy priorities are critically important. Advocates identified in group after group in our meetings that these 2 are potential drivers of epic failure, meaning if we don't figure out cost containment and we don't figure out healthcare literacy, it doesn't matter how effective the rest of the implementation is, it will drive us into epic failure. The next policy priority that emerged as relevant across all settings is the convergence around payment and delivery reforms. That we can't have so many innovations that providers are trying to juggle how they respond with each patient on each plan. That we really need to narrow in on the most effective ones and disseminate them widely and use them widely. And then the last one is the idea we need to protect successes, that we've already had quite a few healthcare reform wins, and we want to make sure that they not only are maintained but continue to grow and be refined. The 5th priority is highlighted in a different color because this one was considered particularly relevant by the advocates in the current environment, in the environment where we're trying but we haven't gotten to the outcomes yet. That integrating care is one of the techniques we can use to move us into healthcare transformed. So that is the description of the context, not just today's but the future context that policy advocacy will operate within in Colorado. The next step that we took in the evaluation design was to think about, given that context, how is change going to happen on those 5 policy priorities? And what might the evaluation be able to pay attention to see how that change is happening? We developed a theory of change, which is basically a description of how change happens in the world tied to specific strategies and specific outcomes leading to a core set of long-term changes. So what you see here at the beginning is a recognition that there's 2 overarching types of strategies. The foundation itself has a lot of work that they're doing in policy, and they're part of this, as well as their grantee strategies and even the broader advocacy field. At the other end, we have the policy targets in pink. These are those 5 targets I just talked about, and we recognize in yellow that we're not going to win those targets overnight. In fact, there's a lot of small wins along the way that get us a little bit closer on each of those. And so we would expect to see these incremental changes long before we see the achievement of any one policy target. In the green, we have a number of different interim outcomes. This is a term we use in advocacy evaluation to describe the ways that the environment has to change in order to have our policy wins. These are significant. Even if we have no successful policy wins in a year, if we move the needle on an interim outcome, we've set ourselves up for much greater success the following year. So we'll be paying a lot of attention to the interim outcomes. You're seeing a list of a variety of types here, things like salience on policy targets, the number and political diversity of champions, the number of advocates doing this work, media framing, improved public opinion, kind of who's involved, consumers and constituents and coalitions. We recognize that depending on what's happening in the environment, what future we're in, some of these will be very relevant and some of them may be less relevant. There may be times where coalition-based work is critical and other times where we actually need to change our political diversity. We need champions from across the aisle. And there may be times when both of those matter or neither of those. The evaluation is designed to be able to pay attention to the interim outcomes that advocates are saying matter in the current environment, rather than measuring movement against a set of things predefined as important by the evaluators. This means we're going to work with advocates to help surface which interim outcomes they're trying to move the needle on, which ones they know have to change in order to get to those policy outcomes. So that leads us into the evaluation design. So the evaluation has a couple of key activities and they're very closely tied to the actual grant timeline. So we have three types of grants in this strategy. One is the general operating grants. The first round has already been awarded. They're 2-year grants. A second round will happen halfway through this 4-year strategy. And then we have program grants each year and rapid response grants that are available throughout. So across these grants we have different types of learning and different timing of learning opportunities that the evaluation will be supporting. Every May there will be an advocacy strategy and learning convening, and the same thing every November. Those are opportunities to bring together evaluation information with advocates' intuitive and strategic knowledge and to think about what's happening in the future, the current scenario unfolding, and be strategic together. We also will be collecting surveys from all of the grantees. In January each year we'll be asking the general operating grantees to submit a survey, and then within 1 month of grant completion we will ask rapid response and program grantees to submit a survey. This information is going to help us surface where you're focusing your work. What is it that grantees are doing to move the needle on those policy outcomes? And it tells us what to pay attention to in the evaluation, so we're not evaluating against something that you know isn't important right now. In order to do that, the survey has a couple different types of information in it. One is just the classic. We'd love to hear what you're doing to advance the policy targets and any barriers you're experiencing. And that helps us understand the approaches that are being used, kind of how the work is moving forward, and allows us to focus the evaluation. The Foundation is committed to providing additional supports beyond the funding, and so it will be very helpful to hear from grantees the supports that are needed. And this is adaptive work. And while the Foundation is recognizing that adaptation happens at their level, they also want to hear about how it's happening at your level. So we'll be asking about that. We will have a set of questions that ask you if you are working with any one of these specific types of changes. Are you trying to reframe an issue? Are you trying to engage decision makers, strengthen existing coalitions? Those questions are critical. They're actually going to be our signal of where we need to do additional data collection. And that leads to what is the additional data collection. So every fall we're going to be doing bellwether interviews. Bellwether interviews are a great technique for understanding the current political and policy environment. They're conversations with individuals who have a really good eye on the broad environment that's happening. They may not be in health policy day to day, but they're paying attention to health policy. They're even thinking about how it's positioned compared to other issues like education or safety. Every spring and also during the summer we're going to do a second type of data collection that's driven by what we learn in the convenings and also what we learn from the grantee surveys. We'll be exploring the interim outcomes and the policy outcomes that you guys say you're working on and that you say are important in this environment to move the policies forward. We might be doing some interviews with advocates as part of it, but also policymakers. We might talk to media champions. We might talk to other influencers. We're likely to be doing some observations, maybe some document review, analysis of framing, might do some media tracking. It all depends on where you see the most important work happening. All of this learning is going to come out in a couple different ways. One is a yearly, twice yearly, post-convening debrief. And this is a short document that surfaces the learnings from the convening and also says something about what was learned from the data collection leading up to the convening. Anytime we're generating anything like this that goes out to the field, at the same time it's coming into the foundation. And we're facilitating debriefing meetings where we use that information to help them inform their next steps and their strategy, how to put together supports that are meaningful for the advocacy field, priorities for the rapid response or program grants, the decisions that they can make that are part of how they adapt along the way. So I want to put all these pieces together. I feel like it's kind of a scattered timeline, but there's a very coherent process to it. And that is that we have 2 learning cycles. The first one is January to May each year. We're analyzing grantee surveys. We're following up on any learning from the last convening. And we're also explicitly reaching out to learn about movement on those interim outcomes based on what we learned in the grantee surveys. That feeds into a May or June strategy and learning convening. And during that convening, we surface a new set of things that advocates are saying they need to know more about, which leads to data collection during the summer and bellwether interviews in the fall. The learning from those 2 pieces feed right into a November or December strategy and learning convening, which again, we generate the learnings from that and turn around and start doing the next round of data collection. So we have these 6-month cycles that are both feeding information back out to advocates and bringing it into the foundation to help with their process. So hopefully by describing the evaluation in a couple different ways, I've given some greater clarity on it. There's also an evaluation handout available that walks through much of the same information. And then there will be a lot of opportunities for you to participate in the evaluation along the way and get more experience being part of this adaptive process. On that note, I'm going to turn it back over to Kelsey. Thank you very much.
Thank you so much, Julia. So as Julia mentioned, in addition to this webinar, you will find lots of information about the evaluation of our consumer advocacy funding opportunity on the website, where you will find a printable handout that provides an overview of the evaluation approach, and you will also find the results of all the briefs from the advocacy convenings as they're created and posted on the website. If you have any questions about the funding opportunity or the evaluation, then we would encourage you to contact Erica Snow, who is our Senior Program Officer, who is overseeing all of this work. We wanted to say thank you so much for taking the time to spend with us to learn a little bit about the evaluation, and we hope to see you all soon.